What is herd immunity? When you're exposed to a disease or a vaccine, your immune system develops resistance via antibodies to protect you against future infection. When there are no people in a population with antibodies for a particular disease, like COVID, that disease can spread really quickly. Basically, everybody is vulnerable to being infected, and often their reaction to the disease can be more severe. When lots of people in a population have been vaccinated against or previously infected by a disease, and thus have active antibodies, it effectively blocks the spread of that disease within that population and protects those who aren't immune. This is herd immunity. What could herd immunity look like in the US? In the US, herd immunity to COVID is a really tough concept because the amount of the population that has been exposed and has antibodies varies so greatly from one place to another. Generally, for viruses that pass through the air, it takes about 60 to 70% of the population to have antibodies for herd immunity to meaningfully slow the spread of that disease. There are some studies that suggest that this may be lower for COVID, but the truth is that we just don't know yet. At the high end is New York City. Several studies suggest that around 20% of the population there has antibodies, so even there we're still a long way from herd immunity. So if we were to just let the disease run wild, you can imagine the tremendous human toll and risk we run of overwhelming the healthcare system. When we think about different ways we might get to herd immunity, one way would be to just let the virus go wild, which, again, would lead to untold suffering and loss of life to get to this idea of herd immunity, which for COVID is poorly understood right now. For example, we don't know how long immunity might last, especially for those who had milder cases, and could lead to a situation where people are being reinfected over and over again. The other way to get there would be to deploy a vaccine, and the immunity it would impart could be for a much longer period of time. Of course, as we've all heard, the timeline on a vaccine is months, if not a couple of years away. So there isn't a quick and effective option available to us at the moment. So what do we do in the meantime while we wait? So the idea of the hammer and the dance is a way to lower the infection rate and prevent spread while we wait for a vaccine and keep our healthcare system from being overwhelmed. We're all familiar with the hammer. This is what we experienced in the past few months with shelter-in-place orders and lockdowns. When these extreme limits are put in place for at least 2 weeks, we then see a dramatic drop in the infection rate, bringing it down to more manageable levels. There are, of course, limitations to this, with an economic impact and a health impact with people avoiding non-COVID-related healthcare. Once the infection rate is much lower, thanks to the hammer, this is where the dance comes in. It's allowing the economy to start opening up to some degree, but still keeping the disease from spreading through testing, contact tracing, social distancing, mask wearing, and so on. It keeps in mind that things aren't back to normal, and that we'll need to remain vigilant to keep the virus under control until there's a widely distributed vaccine that could finally allow us to achieve herd immunity.